Thanks for staying with us. You're welcome back to the morning show here on Arise News. A group of doctors from the Association of Nigerian Physicians in the Americas is in Lagos for their medical week. In the course of the outreach, the doctors will be taking care of more than 3,000 patients, train over 250 Nigerian-based physicians, perform over 350 surgical procedures, perform in excess of 150 eye surgeries, including glaucoma and cataract, as well as attend to more than 200 dental patients. For greater details on this very welcome medical outreach, we're now being joined by President of Association of Nigerian Physicians in the Americas, Dr. Cliff Eke, and the association's treasurer, Dr. Lanre Jimoh. Good morning, gentlemen. Good to have you join us in the studio with us. Good morning.
Good morning, absolutely.
All right, let's talk about why you are here, both of you, and you're free to, interchange in who takes the question. Can you give us an overview of the 2025 AMPA Medical Week, and what are the objectives of why you are here, the Medical Week?
Again, thanks so much for having us.
Absolutely.
Association of Nigerian Physicians in the Americas, AMPA, we've been around for 30 years. This is our 30th anniversary. And to celebrate that, we decided to come back to the motherland or fatherland. So it depends how you look at it. And usually before this, we come every year to Nigeria to do what we call annual AMPA Medical Week, where we do health education, health advocacy, and services. Services include things you mentioned, both medical, surgical, dental, eye. And then we do our annual scientific convention in the US. But because of our 30th anniversary celebration, we decided to combine both and come to Nigeria, of course, Lagos, the main commercial city. And we're doing, so that's a first for us in our history. And we partnered with local physicians and institutions such as Luth, FMC Ebutemeta, Indo Eye Clinic, Rotary International, and many other partners. And we started this on April 4th to 9th, and we saw over 5,000 patients, and also extended care for the first time to Oyo State. We did an outreach there with the Oyo State government. And for surgeries, we did over 500 operations. And then we did a lot of training in basic life support, which we thought was very important because, people drop suddenly, and our people, instead of assisting them, you see people taking video with their smartphones, or they start praying and shouting. But simple chest compressions, breathing for the person, resuscitation while help is coming is very important. So we taught that, among other things, stop the bleed, helping babies survive. But the exciting area for me is the capacity building and skills transfer. And especially for the eye, we were fortunate to come with one of the professors of ophthalmology in Duke University in the United States, Professor Leon Hendon. He's one of the top 5 glaucoma surgeons in the world. And he was here in Nigeria at the Indo Eye Clinic. Besides the 387 cataract surgeries that were done, they were able to do 35 glaucoma operations in 3 days. And according to the director of Indo Eye Clinic, Mr. Tarun Sangvi, he says this has never been done in the history of Nigeria. This is the first, that you can do that many glaucoma surgery in that short a time. Cataracts, all eye surgeons do it. It's common. Yeah. The glaucoma is a special deal, especially when it becomes surgical and not a medical issue. So because we were doing that, the Ophthalmology Society of Nigeria, or OSN, actually partnered with us and brought 65 of their members to be trained by this world-renowned eye surgeon. So that when we leave now, the skills will stay with them, and they will continue to do this specialized surgery for our people.
That's amazing. Oh, I just have to say, welcome back.
Thank you.
So we're seeing a huge exodus of our doctors in Nigeria, the Japa syndrome. How would you say the work that you're doing right now would align with our broader, development plan for our health industry in Nigeria?
Well, the Japa syndrome is really an endemic problem in Nigeria for several reasons. And we don't have time to go into all of that right now. But what we are hoping to do is to start a movement called the Jakbada, which is a return of a lot of us who have left. And how do you encourage people to come back? Coming back to Nigeria is a tough decision to make. People don't jump into it. They have to almost sort of put one foot in the water, test it out. But we have to create the environment for that. We have to make it easy, less risky, more likely to succeed. And so what AMPA is trying to do is to create that environment, create that machinery so that people from the diaspora, not just American-based, but other countries, UK, Australia, South Africa, wherever our talent has gone to, how can we create an attractive avenue working with local stakeholders in this country, both in the public and the private sector, understanding how we can create a business case and the reassurance that when they come here, they'll be able to work in the way they're used to. They'll have the capacity. We have to build the capacity because, as a proceduralist, as a surgeon, if I come and I don't have my surgical techs, my endo techs who know what to do, I'll be frustrated. So there's a certain level of work that we need to do, and that's what AMPA is doing with our skills transfer and capacity building, is to build all the other members of that team so that for someone like me, highly skilled, and him, and bringing those skills back, we know we have an environment where we can actually do our work. There's nothing more frustrating to have the skill set, to be there, but you don't have the tools, you don't have the support. Eventually people will leave back. So we don't want that to happen. So we're being very methodical and taking a long-term view on how we can do this in a sustainable manner. And that's what AMPA is sort of switching to now that we're 30 years old. Nigeria is squarely in our focus. And this is the beginning of bigger plans that we have for the country.
All right, let me stay with you, Dr. Jimoh, so that after that the president can come in, given the explanation that you have offered. How does this medical mission, the component of it, how does it address obvious healthcare gaps in Nigeria, particularly the underserved communities? And what have you observed, coming, this is your 30th year, what have you observed particularly this year? Which areas do you think that interventions are needed so that we just don't keep doing same things, all over, so that AMPA can be a partner in development in the areas of gaps that you might have identified?
Thank you so much, Steve. The question you've asked is interesting because we've been doing medical missions for about 25 years now. This was our biggest medical mission yet.
Wow.
Over 137 people volunteered to come and do this in Lagos. And we actually paid to do it, to support ourselves.
Wow.
Now, the gaps we saw, multifaceted. Healthcare worker shortage, healthcare worker sort of discouragement. Even people who are there, some of them are mentally checked out. They need more support, more remuneration. The facilities were varying in levels of adequacy in terms of the equipment, supplies. I must commend the federal government, work they've done at FMCA Butemeta. We were very impressed with the status of their facilities, basically. And same with Luth. I mean, there are people who want to work. The reception we've gotten from our colleagues, our local Nigerian doctors, surgeons, ophthalmologists, dentists, just the outpouring of support. They came in large numbers to learn, to work with us, to partner. The patients, we love to say we want to do medical missions until it is no longer necessary, right? We understand it seems like it's a drop in the bucket. But if that drop was your family member who has access to glaucoma surgery, which will otherwise not be available in this country, if it's just one or two people, we did over 30, right? But if that person is able to see and they remember that AMPA doctors came and changed my life, now, how can we train the people here so they can continue? That's what Mr. President talked about. So to answer your question, there are so many gaps, and all these gaps are things that we have a lot of expertise, whether it's healthcare finance, healthcare equipment supplies, healthcare policy, advocacy. These are things that AMPA has built over the 30 years. We have committees that look at these things. And one more thing I'll add quickly is that when we do these medical missions, we don't just come and go. We come with a lot of supplies, a lot of equipment. In the GI area alone, we donated over 31 million naira worth of supply to Luth GI Center and 31 million to Ebutimeta naira of endo supplies, forceps, clips, everything, and we gave them as a gift. We're not taking it back. And surgery is even more than that. It's over 50 million naira worth of surgical supplies. Wow. I mean, we partner with United Airlines to ship, boxes, pallets of supplies that we bring. It's a huge intervention. What AMPA is able to do, no other medical organization is able to do medical outreach of the scale that we can do. So we are a big partner, and the need is very evident, and we're going to keep working on it.
Absolutely. I mean, I'm so impressed to hear that there's a lot of partnerships going on. But then, in as much as there's a lot of good happening, we now have to think of the fact that we have a lot of government policies, initiatives that may support or hamper this growth. So based off on your assessment so far, are there specific government initiatives or policies that, and I'm going to direct this to you, Mr. President, that you think could support the work that you're trying to do here in Nigeria?
Yes. And to piggyback on what Dr. Jimoh said, I think the key for us is prevention and primary care. Even though we have to take care of people that are ill now, obviously, and do the advanced stuff, we get the best on our investment on primary care and prevention. So I think the government can enable that by revamping the primary care system. And interestingly, in Oyo State, I mentioned earlier, the governor there has remodeled at least 299 centers, according to the report. In Oyo State, there's 700 and something more. And Lagos.
Were you on ground in Oyo State?
Yes.
In Ibadan?
In Ibadan. Oh. Yes. Part of this for the first time, AMPA now is doing in 2 states, as opposed to just one. So we're expanding and hoping to build on that. That was a challenge, actually.
Is that where Dr. Jimoh is from?
I'm from Osun.
Okay. I'm just kidding.
Good point, though.
I went to ISI. I went to school in Ibadan.
Oh, ISI. Okay, yes. All right.
But that's actually a challenge from former President Olusegun Obasanjo. He came to our convention in New York in 2023. And he saw the things we're doing. He said, why limit it to one place? Try and expand. So this is the first time we've tried it. And we're hoping next year we'll do that. But like he said, actually our wish is one day when medical mission is unnecessary. Really. We don't want to be doing that. Although even in advanced countries in the United States, I do medical mission. I volunteer to places where people are uninsured or underinsured and give my skills for free. That's medical mission. But it's not the norm. Most people have access to care. So government, besides the primary, strengthening our primary health care centers, we need to leverage on technology. AMPA has been able to establish telemedicine in Edo State in 2022. That's still in existence. And our doctors can consult on patients in primary health care centers in at least 5 to 7 currently as we speak in Edo State. That's another way to jackpot. We don't always have to come here physically. We can leverage technology. Something else is investment in our national health insurance system, right? We're supposed to have universal health coverage. But when I go to my village in Owerri, I can't count 2 people that tell me they are covered. That is huge when you don't have access to the facility to be taken care of. So we need to rethink that. That's where government comes in, get a reputable people to be able to make it so it's not just affordable, it's accessible and administratively very simple. So that wherever you go, you can get your primary care, preventive care, screening mammograms, screening things that will prevent you from getting before you get sick. Interestingly, we pioneered, AMPA, one of our radiologists, sponsored 500 free mammograms in collaboration with Lakeshore Cancer Center at this visit. Among many other things, we did what we call menstruation education for young girls at Wavecrest College of Hospitality, about 50 young girls. We don't talk about this.
Wavecrest in Surulere?
Yes. And we told them about the reproductive system, not to be ashamed of the menses, and at the end, taught them how to make reusable feminine pads. These are all impact, again, skills transfer, capacity building. So when we're gone, they will continue to do that.
All right. Before we let you go, President, and I think Dr. Jimoh too can add to it, all these lead to the sustainability question. This medical outreach, what are you putting in place to ensure that there will be sustainability? And very quickly, maybe you might just want to also mention in the short to long term, the telemedicine part that you mentioned. How can these be connected to the question of AI in medicine? You know, is that something that we should be?
We have to be thinking of that, for sure.
Yeah.
So sustainability, AMPA now, we've noticed that health is expensive.
Yeah.
And health is a business.
Absolutely.
So, like he said, we paid to come here. Our ticket, nobody is paying us, we're losing income, and then, you know, all the consumables and things we bought. So it costs money. So AMPA now has developed a new business arm called Global Health Standard Care, which we're going to launch tonight at our gala. And you guys are invited, by the way.
At the hotel?
Yes.
At the hotel.
Yes. And the idea is, because again, our government, our president, is actually encouraging the diaspora talent to come back.
That's correct.
Lagos State is building a big medical community hub. And they want to be the center of excellence for West Africa, so to speak. Yeah. But they need us. They need diaspora, not just AMPA, Mansag, Campad, South Africa, Australia, all of them. And they were here actually at our convention. So we work together. And if we can galvanize that, then we can come and help bring all this talent back. Two, your second part of your question was using AI.
Yes.
We have to, technology is very important. So with our telemedicine in Edo State, initially AI was not available.
That's right.
Now, as we transition, we have to incorporate that. But we need, again, a government that's willing to welcome us. Back then, the Edo State governor invested in the internet and the computers, laptops that are being used now. So if other governors can follow suit and then we incorporate AI to it, actually,
and the minister too, maybe Dr. Pate is quite, you know,
and actually,
open to stuff like
yes, I think he is. Actually, Dr. Pate, I'm glad you brought that. Both Dr. Pate and Dr. Salako, the Minister of State, were very supportive in this mission, logistically. And also even Dr. Alaosa, former Minister, you know, of State for now education, and also he's still
a Lagos boy, by the way.
And they are AMPA members, by the way.
Oh, fantastic!
Yes, both
Dr. Pate and Dr. Alaosa.
Exactly.
Oh, great!
Yes.
Oh, great!
Yes.
That's right. I mean, what can we say? Congratulations and well done.
Thank you. And finally, we want to come and establish our presence in Nigeria, the JACPA that he said.
Yes.
Okay, we want to have
That's
an
important.
office in Nigeria and hopefully a center of excellence for AMPA.
Okay.
That all these complex things can be done.
Fantastic.
But again, we can't forget prevention and primary health care. Okay? So,
fantastic. Dr. Ike,
Thank you for having us.
Dr. Jimoh, thank you for joining us on the morning show. Fantastic submissions and well done.
Thank you so
You're doing well.
Thank you.
Well done.